My name is Dr. Rohit Dal. I'm one of the neurologists at UAMS. Often the diagnosis of Parkinson's disease is made on clinical grounds. We look for the cardinal symptoms of slowness and stiffness, and if there's a tremor, of the characteristics of the tremor. We also can do some ancillary testing to confirm the diagnosis. One of the things that we have available at UAMS is a special scan called a dopamine transport scan that allows us to look at the integrity of the dopamine system, know that the dopamine system is working well. And it's one of the few centers in the state that is able to do that scan to confirm the diagnosis. In our clinic, we provide a multidisciplinary approach. We try as neurologists, as my neurosurgeon, as speech and physical therapists, as our counselors and neuropsychologists, we try and form the team around our patients to give them the services that they need, be it clinical care, be it support, be it participation in clinical trials and research, be it educating the next generation of doctors. So our goals are to provide the support that our community in Arkansas needs for their neurological care and for continuing to contribute to the care of the future generation as well. We're at a place in history where we're probably a couple of key breakthroughs away from finding a cure for Parkinson's. Unfortunately, we've been at this place for the last 30 years. The more we understand about the disease pathology, the more we know that we need additional work. And I think the question of what drives optimism or hope in Parkinson's disease comes up in the clinic as much as it comes up when I go talk with patient support groups or when I'm talking amongst my colleagues, the doctors who take care of Parkinson's disease quite frequently. We now understand the disease pathology in better detail than we have ever in the history of Parkinson's disease. We now know some of the genetic and molecular mechanisms of Parkinson's disease development, and in advancing our optimism, we're developing targeted therapies towards these molecular and genetic mechanisms. There are challenges in developing these therapies. That's what wakes me up in the morning. That's what excites me, is trying to bring those therapies to our patients and trying to develop ways in which we can make the diagnosis as quickly as we can, get our patients through the appropriate evaluation process, give them the tools that they need to live a better life, but also show them where we're at in research for Parkinson's disease and where some of the likely breakthroughs are going to come from.